Hello everyone, welcome back to our channel, Medical Coders Coaching World CPC. This is your tutor Bhumadevi Chandrasekharan from Abu Dhabi. Today we are going to see about Chapter 12 in ICD-10 CM. Chapter 12 is for diseases of skin and subcutaneous tissue. The code ranges from L00 to L99. In this we will cover all type of diseases for skin and subcutaneous tissues and how to code for these diseases. And the first topic is pressure ulcer stage codes. How to code for pressure ulcers? Pressure ulcer is a kind of disease which occurs in the skin, and we have to code according to the stage of pressure ulcer and the site of pressure ulcer. So how we will code for pressure ulcer? Come, let's see that. Pressure ulcer stages. L89, the category L89 is for pressure ulcer, and before giving the code we have to identify what is the site of pressure ulcer and as well as the stage of pressure ulcer. We have to identify this, and according to this we have to give the appropriate code for the pressure ulcer. And the stages is classified based on the severity of pressure ulcer. The stages of the pressure ulcer is classified based on the severity of pressure ulcer. If a patient having more pressure ulcer, one or more pressure ulcer at the same site, then we will get a confusion which will be coded first. So to avoid these confusions, first we have to identify the severity of the pressure ulcer at the same site or any different sites, and based on the severity we have to give the stages for pressure ulcer, and we have to sequence the code. And the stages of pressure ulcer is from 1 to 4. Stage 1 to 4. Pressure ulcer stages are from stages 1 to stage 4, which is unspecified also there and unstageable also there. The next is unstageable pressure ulcer. What is classified as the unstageable pressure ulcer and what is meant by that and how to code for this is covered in this topic. And the pressure ulcer stages cannot be clinically determined. The pressure ulcer stage whose stage cannot be clinically determined, that is called unstageable pressure ulcer. And another one is there in which the pressure ulcer that are documented as deep tissue injury but not documented due to trauma. Due to trauma the pressure ulcer is not documented, but it is documented as deep tissue injury. Instead documenting as pressure ulcer, the providers is documented as deep tissue injury. That is also comes under the unstageable pressure ulcer. So the unstageable pressure ulcer means whose stages cannot be clinically determined. The pressure ulcer whose stages cannot be clinically determined, and the pressure ulcer that are documented as deep tissue injury means then this comes under the unstageable pressure ulcers. Next is unstageable pressure ulcer. The unstageable pressure ulcer is L89 point. There is two gaps. There will be two numbers will come. So that's why I quote as hyphen in that, underscore in that. So L89 point XX0. Let us assume as X in that gap. Okay. So L89.XX0 is for unstageable pressure ulcer, and unspecified pressure ulcer is L89.XX9. So this is for unspecified pressure ulcer. We should not confuse between unstageable and unspecified. Unspecified means there is no documentation regarding the stage of pressure ulcer. So then it is unspecified pressure ulcer. Unstageable means we cannot able to determine clinically in what stage the pressure ulcer is. So if we are not able to clinically determine, then it is unstageable pressure ulcer. If there is no documentation regarding the stage of pressure ulcer, then it is unspecified pressure ulcer. Again I am saying we should not confuse between unstageable pressure ulcer and the unspecified pressure ulcer. Then the next one is documented pressure ulcer stages. Already the pressure ulcer stages is documented, then how we will code? Assignment of the pressure ulcer code is guided by clinical documentation of the stage. Documentation is provided by the provider either or else if the provider is not providing the document, then there will be some terms present in the alphabetical index. So according to that, or the clinical documentation of the provider, by using both, we can document the pressure ulcer stages. Suppose if the stages are also not found in the alphabetical index and the provider also not mentioned in the document, then what we will do? Then we have to query the provider about the stage of the pressure ulcer which is not documented in the document, which is not mentioned in the document. So this is the documented pressure ulcer stages. Next one is patient admitted with pressure ulcer and documented as healed. If the patient is admitted with pressure ulcer and they documented as healed means, then we have to give, we should not give any code for the patient. The next one is patient admitted with pressure ulcer and document as healing. If the patient is already admitted for pressure ulcer and it is documented as healing means the treatment is going on and the patient is getting healing on pressure ulcer. Okay, so if it is like that, then how we will code? We have to code appropriate stage of the pressure ulcer mentioned in the medical record. What stage is mentioned in the medical record, according to that stage we have to give the code. If there is no information regarding any stage of the pressure ulcer, then we have to assign code from unspecified pressure ulcer code, we have to assign that. If the documentation is unclear, like the patient is having current pressure ulcer, they are getting treatment for current pressure ulcer, or that means a new pressure ulcer, or they are being treated for healing pressure ulcer. Already the pressure ulcer is healing and they are getting treatment for that pressure ulcer. If the like this, the provider will not mention any kind of information like this, then it is considered as the documentation is unclear documentation. So then at that time we have to query the provider. And if the pressure ulcer is present on admission and it is healed on discharge, then how we will code? What code we will assign? In that time we will assign the code for site and stage which is present on the admission time. Which site and stage is affected during the presence of admission, for that code we have to assign for the patient. The next one is patient admitted with the pressure ulcer and the stage is evolved during the admission. If the patient is getting admission with the pressure ulcer and the stage is evolved during the stay of admission means, then how we will code? We have to give two codes. One is for site and stage on the admission and the second code is for same site and stage evolved during this stay. Like if the admission is for 4 days, the patient is admitted on pressure ulcer on the leg and first stage of pressure ulcer means, then we have to give one code for pressure ulcer on the leg and the stage for first stage pressure ulcer code in admission time. The first code is for that and the second code is for the same site and it is evolved, the stage is evolved during the stay. Like the stage goes to 4th stage means, then we have to give the same site. Second code is for the same site on the leg. Example, the patient is having the leg pressure ulcer on the leg and it is evolved to stage 1 to 4 means the fourth stage is the fourth stage will be mentioned the second code, mentioned in the second code. So one is for site and stage on the admission and the second one is for same site and stage evolved during the stay. So this is the guidelines for this kind of coding. And the second one is non-pressure chronic ulcers. In this we will see the same topic only, like a pressure ulcer code, pressure ulcer topics. Whatever we look in the pressure ulcer code, the same topic we will see here, but little bit alternative in the coding guidelines. Patient admitted with non-pressure ulcer and documented as healed means, then we should not assign any code for the patient because it is documented as healed. And the second one is patient admitted with non-pressure ulcer and documented as healing. It is getting healed. Okay, it is getting by giving the treatment, it is getting cured. Okay, so that kind of patients, how we will code? We have to give appropriate non-pressure ulcer code based on the medical record documentation. The documentation on the medical record means based on that we have to give the appropriate code for non-pressure ulcer. If there is no documentation or no information in the documentation about the severity of non-pressure ulcer, then we have to assign code for unspecified severity. Then if the documentation is unclear, I already told unclear means like if the documentation doesn't provide any information whether the patient is taking treatment for new pressure ulcer, current pressure ulcer, or already the pressure ulcer is there and they are giving treatment for the pressure ulcer and it is getting healing. Like this, the information is not provided in the documentation, then it should be considered as the unclear documentation. If this type of documentation, we have to query the provider what is the stage of pressure ulcer and what is the site of pressure ulcer, and we have to query the provider, like we have to get some information from the provider to assign the code. And if the pressure ulcer is present, non-pressure ulcer is present during the time of admission and is getting healed at the time of discharge, then how we will assign the code? We have to assign site and severity for non-pressure ulcer during the time of admission. We have to assign code for site and severity for non-pressure ulcers during the time of admission. The next topic is severity progresses during the admission. That means the severity is progress during the admission stay. Okay, for this two codes we have to give. One is for site and severity at the time of admission, and the second is for same site and the severity evolved during the stay. So we have to assign two codes for this kind of patients. So these are the guidelines for assigning codes for diseases of skin and subcutaneous tissues. If you are having any doubt in this chapter, please do comment in the comment section or email me in my personal email. I will reply you as soon as possible. I will give my personal email in the description box. Please go and find it out. And if you are a new viewer of our channel, please do subscribe our channel and click on the bell icon which is near to subscribe button. Then only you will get notified all of our channel updates immediately. If you like this video, please like, comment and share. Thank you from Bhuma Devi Chandrasekharan.